بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على أشرف الأنبياء والمرسلين وعلى آله وأصحابه أجمعين أما بعد. To all the viewers on Facebook and YouTube, we are here at Zia-ul-Ummah Centre today, and we are here to talk about in regards to the difficulties that the world has been facing, but in particular in the United Kingdom in regards to the coronavirus COVID-19 pandemic. And this is something which has affected most people in the United Kingdom. But today, alhamdulillah, we have a top doctor by the name of Imran Hussain, who's a practicing GP in Birmingham, in College Road Surgery, King's Standing. First and foremost, we would like to welcome you, Dr. Imran Sahib, and thank you for taking time out. And I understand you've been extremely busy and you've just finished work, and you've just come straight to Zia-ul-Ummah Centre. We thank you for that. Jazakallah khairan. Also, for the viewers, we are keeping our safe 2-meter distance between myself and Dr. Imran Hussain. I understand you have a few points that you would like to make, and I would like to give you the opportunity to pass out the message to our young community and to our elders, and whatever it is that you've prepared, we would like for yourselves to take as long as you want, and then I have a few questions at the end as well, inshallah ta'ala.
Sure. So Jazakallah for the invitation. Assalamu alaikum to all our viewers who are watching us. So I think in terms of the current crisis that we are seeing, in terms of the coronavirus, there are a few basic points that I just want to emphasize. I'm sure we've heard these points again, but it is important that we understand.
Thank you.
So essentially, what is the coronavirus? It's a new type of virus that our body does not recognize. So we have no immunity against it. Therefore, it can be quite dangerous to those people that have weakened immune systems, or who are elderly, or who have other existing conditions, and it can be life-threatening for them. Which is why we need to make sure that as a whole group of population, we take all the precautions that we can in order to minimize its spread. And that's why we're seeing all the campaigns with regards to self-isolation and so on. So it's a new type of virus that is not recognized by our immune system. How does it spread? It spreads through respiratory droplets. So every time we cough, we breathe out, and there's always respiratory droplets mixed in with that. If we touch a surface and we leave traces of the virus there, it can spread through mucus, through sharing plates, through drinking from the same cup, for example. It can spread through blood contact. So it is important that we minimize the spread of this virus by tackling and understanding how it's spread. So, for example, washing your hands regularly for 20 seconds with soap and water will ensure that the virus that is on your hands will be washed away. In the same way, ensuring that any surfaces that you come in contact with are cleaned regularly with alcohol gel, or wiped clean with soap and water, or whatever you have, will minimize contact with those surfaces and then you spreading that on with your hands. Social distancing is important because the virus can spread if there is a contact of less than 2 meters from the other person for more than 10 minutes. I think we should be wearing masks today, but we we've kind of taken that decision. But it's important that you do wear masks if you can do so, because the masks do affect the spread of respiratory droplets in close contact. They're not completely effective, but I think something is always better than nothing. Social distancing is important because, again, you're keeping more than 2 meters or at least 2 meters away, so you're minimizing the spread of the virus. And then, of course, if you have developed the symptoms, then self-isolation for a period of 7 to 14 days is important. Why is this important? As I said, I mentioned that elderly people are particularly vulnerable from this virus. And the data that we have is continuously changing and new data is coming through. But so far, the data that we have from China and other parts of the world is that 80% of the people who have this virus recover from it. So alhamdulillah, that is good news. The remaining 20%, out of them, 15% sort of suffer quite badly with the virus. They have what we call severe symptoms. And the 5% basically have ITU admission. So you have 80% recovering fine from it, 15% moderate to severe symptoms, and 5% have ITU admission. And the mortality rate, the number of people that die from this virus as a percentage of the total people that have the virus or have been infected with it, is in the region of 1 to 2%. But as more data comes in, that will change as well. Now, people who are particularly vulnerable to it are anyone who is over the age of 50. They tend to develop more moderate to severe symptoms. People who have coexisting conditions such as heart disease, kidney disease, respiratory illnesses, diabetes, they tend to be suffering with more moderate to severe symptoms. In addition to that, people who are quite elderly, people who are on immunosuppressants, they tend to suffer, and we've seen higher mortality rates in them. And the mortality rate increases with increasing age. The worrying thing with this virus is that you can sometimes not have any symptoms or have very mild symptoms, and you may not know that you have the virus. So you could be walking around, passing it on to other people, and not knowing that you are doing so, unless you're tested for it. Obviously, testing is limited at the moment, even though we're seeing that it's being widely available. But that's going to take time to roll out in such a manner that everyone has tests available freely. But nevertheless, the government is working hard on that. But until that happens, I think we have to be very careful, especially the younger people that I want to give the message to, because we all have elderly people in our houses, in our homes, or in part of our families. And if we, first of all, if we develop the symptoms, then we should act very responsibly, stay in the house, isolate ourselves, follow the guidance that's issued by NHS 111, and do speak to them if you do develop symptoms. They also have online information available as well. But more importantly, act responsibly by ensuring that we protect our elders. And in doing so, we are actually then helping them to avoid getting infected. I think I want to leave it just there, really. Those are the key messages that I wanted to sort of tell people about. Obviously, people will have questions. I'm sure you will have questions, and then we can expand on these points. But I don't want to talk too much here.
Jazakallah, thank you for that.
Yeah.
I have a number of questions here, which has been asked by our congregation here at Zia-ul-Ummah Centre. Now, to be honest with you, you've pretty much covered at least 50% of the questions that I have. But for our viewers and for our congregation, the first question was, how can I protect myself and others from getting COVID-19? And these are the government, what the government has told us, and their instructions is to have that social distancing and washing your hands and general hygiene. And at the same time, as you very importantly mentioned, and I've mentioned this in my Friday sermons as well, is in particular with our youth, the ones that go out and walk around, they could possibly be carriers, But when you get back home, you have elders, and this is something that we really need to take seriously. And I do believe a lot of our elders have been affected because since the lockdown, I know, and this is amazing, that our elders have stayed at home. They've quarantined and they've self-isolated. However, the youngsters are still going out, and when they come back, and a lot of our elders, or some of our elders, have been affected by it. Coming back to the second question was, should I wear a face mask? Now, Dr. Saab, one of the things is, a lot of the youngsters say that they feel embarrassed wearing face masks.